Good morning, everybody. I am Sani Acharya, your host for today's live talk all about skin allergy treatment. I am sure all of you must be keeping good health. Today, we are going to discuss about our skin healthy with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by round rash on the skin that itch intensely. It may be due to chemicals in certain foods, allergy to certain medications, insect stings, sunlight, and sometimes the cause is unknown. As per study published in Indian Journal of Dermatology, Venereology and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidence is higher in older age group. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early revision. In today's digital world, it has boom or blessing if we can get to hear from an expert dermatologist online about urticaria and its type, how we can prevent it, and the kind of tests required for a diagnosis, the right treatment, and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us a renowned dermatologist of India, Dr. Meenal Mittal, live from Mittal Skin and Aesthetic Clinic, Ramghat Road, Aligarh, who will educate us more about urticaria and its management. Dr. Meenal Mittal has over 9+ years of experience as a dermatologist. Dr. Meenal Mittal is a Bachelor of Medicine, Bachelor of Surgery, MBBS Medicines, MD Dermatology. Dr. Meenal Mittal treats skin, cosmetic, pills, cautery, scar removal, acne care, and acne scar surgeries, hydrofacial, laser hair removal, and phototherapy. So, welcome, Dr. Meenal Mittal.
Thank you so much, Ananya. Good morning, everyone. And today we'll be discussing about the management of urticaria. First of all, we'll discuss in brief about urticaria, as you already told, but we'll discuss a few points about the types and causes of urticaria. Then after that, we'll move on to the prevention and management part of urticaria.
Okay.
So, what is urticaria? Urticaria in common language we known as hives, or sometimes people also call it कि पित्ती हो रही है डॉक्टर साहब, पित्ती की परेशानी हो रही है, हो जाते हैं, उसके बाद rashes हो जाते हैं. So, urticaria in or wheals we called as, sometimes it is associated with wheal and sometimes with angioedema, and sometimes both wheals and angioedema is present. So wheals are the pale color swelling or skin colored swelling which are surrounded by erythema or rash surrounding redness. And in angioedema, there is more of swelling around the lips area, in the nose area, and the eyelids. There is more swelling, and angioedema is more painful and the wheals are more pruritic. They are more itchy, and the angioedema is more of a painful swelling. Sometimes they both coexist, and sometimes only wheals and sometimes only angioedema is present. So, now coming to the types of urticaria based on the duration. If there is less than 6 weeks of duration, if wheals or angioedema is present, it is called acute urticaria. If the wheals are present for more than 6 weeks with angioedema, it is called chronic urticaria with angioedema. So accordingly, there are different causes of urticaria. Like for acute, they are different. For chronic, there are different causes of urticaria. For acute, the most common causes are the infection. Any infections like viral infection, bacterial, parasitic infections. All these can lead to acute form of urticaria, which is present for less than 6 weeks. And for the chronic form, and there are some other causes for acute urticaria can be any drug related, any medications, food allergy, allergy to insect bite, allergy to bee sting, and latex allergy. Anything can cause acute urticaria. Now coming to the chronic urticaria, the chronic one which persists for more than 6 weeks, it is also of two types: the spontaneous one and the one with the causes. The spontaneous urticaria is more persistent. It persists for more than the inducible ones. Now the chronic form which persists for more duration, the spontaneous one, and it is mainly related to some thyroid causes or autoimmune diseases, thyroid diseases, diabetes. Sometimes these are associated with the thyroid causes. And the inducible ones are the ones which are related to any heat precipitation, cold precipitation, and because of there is cholinergic urticaria, then there is ecogenic urticaria. There are various according to the causes that there heat urticaria and there is uh, vibration, pressure urticaria. There are different types of urticaria depending upon the cause of, depending upon the precipitating cause. So and the inducible ones are present for a very short duration, and the spontaneous ones they are present for a longer duration. So this is all about the uh, causes of urticaria, the types of urticaria, and what is urticaria. I've already discussed about the angioedema. Now there is when we want to diagnose urticaria, it is mainly clinical diagnosis, and for that it is important to take the history of duration of urticaria, the frequency of lesions, and the time of time of onset, the precipitating factor, and duration of lesions. If it is for if the lesions are present for less than 24 hours, this it is urticaria. Sometimes the lesions are present for more than 24 hours. It is called urticarial vasculitis. It is also important to differentiate urticaria from urticarial vasculitis. In urticaria, there is no residual pigmentation after the lesions goes away. There is no residual pigmentation or echinosis. But in urticarial vasculitis, there is residual pigmentation also. Sometimes there is associated myalgias, joint pains, arthralgias, or fever associated with urticarial vasculitis. And and the urticarial vasculitis is more painful as compared to the usual urticarial complaints. So, any personal family history, food history of allergy, and exercise induced or heat induced, hot drinks induced urticaria, all these things should be ruled out to find a proper cause of urticaria. And then the investigations part, coming to the investigations part, uh, what necessary investigation should be done uh, to rule out to determine the exact cause of urticaria. It's like the complete blood count and the thyroid related uh, thyroid, thyroid related investigations, TSH, thyroid antibodies. All these things should be done to find out the proper cause of urticaria. And with
So, ma'am,
if there are any questions we can take in between before moving to the management part.
ma'am, how does urticaria look like, and is it an allergy?
Okay, urticaria is a form, it is a condition, it is not a disease, but it is a condition. Because in urticaria, there are rashes, like I told you, there's a pale colored or skin colored swelling surrounded by rash or erythema. And mostly it is like normal in common language, the patient complains कि मैम जैसे चींटी काट जाती है उसके बाद ददोरे हो जाते हैं उस तरह का रैश हो जाता है. So this is the typical history the patient gives with urticaria. And rest we can investigate for the diet test and serum Ig levels. We can investigate if there are any autoimmune conditions associated. And now moving to the management part of urticaria. And okay, so before giving any drugs and any medications for urticaria, it is very important to find out the exact cause, what is an exact triggering factor that is inducing urticaria. For that, it is important to maintain a diary or a note that whatever things that are precipitating your problem. for a patient, it is important to manage a diary, a login diary, where you can note down what all things that are precipitating your problem. And when you go to your doctor, when you consult your doctor, you just go and show them that these are the things that that are precipitating the problem, so that he or she can rule out what is the exact uh, cause of urticaria. And first and foremost, it is to avoid that triggering factor. Before starting any medications, it is important to avoid that triggering factor that is causing the urticaria, whether it is heat, whether it is cold, whether it is because of exercise or exercise induced urticaria, because of water. Sometimes after the patient complains that when we come out of the after bath, there is continuous itching and urticaria all over the body. So they should be ruled out. Sometimes at pressure sites like the belts at the waist area, all these things can precipitate urticaria at the sites, like bands. Some people use bands at the hand, or there is urticaria at the site of the band, or rashes at the site of the band. So these are the precipitating factors that should be avoided, and uh, should be determined before starting any treatment. And as I've told you about the login diary, so that it is easy for the consultant also to make a note of what all things are precipitating your factor, your problem. And after that, we'll start with the drugs which are non-sedating antihistamines, the first line therapy for um, urticaria. The non-sedating antihistamines can be levocetrazine, cetrazines, and desloratadine, sphexophenidanes. All these are the drugs which are in the first we'll start the drugs in the usual dose that we give, and then if we look for 2 weeks, 2 to 4 weeks, and if the response is adequate, then it is okay. We'll continue with the same dosing. But if there's no adequate response, we'll updose the same molecule, and then we'll if there and after that also, after 4 to 8 weeks also, if there is no response, we'll add a second drug also, like sometimes we give steroids also in short courses to if there is associated angioedema with the problem, then we give short courses of steroid also. Some immunomodulatory drugs like cyclosporin, methotrexate, and methotrexate, and biologicals like omalizumab, and all these drugs are also given in for the management of urticaria according to the problem, according to the type of urticaria, according to the duration of urticaria. The treatment plan is different for every patient. And
Right, ma'am. So, ma'am, what are the potential complications of urticaria if it is left untreated?
okay, if there is urticaria only, then there are no probable complications. Just there is there is possible deterioration in the quality of life because of the continuous itching, and you are not able to concentrate on your work and daily routine activities because of the urticaria issues. But there are no as such complications in if there is just urticaria. But if there is associated angioedema also, and there is swelling of the lips, eyelids, and if there are recurrent attacks of angioedema, so this all these things can lead to complications also, because there is associated laryngeal edema also, which can uh, uh, which can lead to death. So in cases of death also, in cases of angioedema, if there are repeated attacks of angioedema. So if there are repeated attacks of angioedema, then it is important to take an necessary precautions, and immediate treatment, emergency treatment should be advised accordingly.
Right, ma'am. So, ma'am, can urticaria be caused by stress? And if yes, then how do stress urticaria looks like?
Okay, stress is the precipitating factor. If there is already, if you have urticaria, it can precipitate the flares of acute flares of urticaria. If you have a history of urticaria in the past, and then there is a period of stress, then all these things can precipitate acute urticaria in some cases.
Right, right. So, if anybody have urticaria, they can consult their nearby dermatologist. That is very important, right, ma'am?
Yes, yes. Because if it is not possible to take the treatment on your own, never try to take the treatment on your own, because it is important to rule out the most important triggering factor, the inducible factor, and accordingly the treatment and medications are advised. And it is not like just you take the antihistamine and everything will be okay. So you have to take the medications in a proper dose, duration, and and additional molecule and additional drug if required. Proper sometimes we also advise topical medications also for immediate relief of some like calamine lotion and other molecules that provide immediate relief and immediate soothing effect if there are acute flares of urticaria.
Right, right, ma'am. Ma'am, so when we talk about urticaria, so does it like that hives or urticaria get worsen at night, or why do hives or urticaria get worse at night?
Okay, sometimes it gets worse at night because of some if the patient if the problem is persistent for a longer duration, uh, from morning to evening the people are busy in their daily routine activities, so they have no time to look towards that problem. They're busy in their daily routine activities, but at night when you are relaxed and you are on your bed, so the problem the problem is more at the night. So this is the reason the problem is more at the night time. Otherwise there is no particular cause the problem that the urticaria is more at night. uh,
Okay, doctor, does urticaria makes you tired? Is it like true?
Sorry.
Does urticaria like makes you tired, like feel you like tiring and
It makes you tired because every time you are itching and you are unable to concentrate on your work or focus on your work. It is like you are every time you are itching here and there, and you are always so it is tiring in a sense.
right, right, doctor. So, is there any dietary precautions one should take or do's and don'ts for patients of urticaria?
Okay, dietary precautions. If there is anything that is precipitating the problem, that is inducing your sometimes the people have allergy to egg also, the dairy products and eggs and nuts, peanut allergies. People have different kind of allergies. So those things that you know that may aggravate your problem, that should be avoided. Like so that food diet should be avoided, that you think that is aggravating your problem, that should be avoided.
Okay, so ma'am, now we have live viewers who are watching us. So now we have their questions. So Sanjay Meena is here and asking, ma'am, in pregnancy sometimes urticaria occurs. Which medicine you suggest in this condition?
Okay. Usually in first trimester, if the problem is more, we give chlorpheniramine, and in second and third trimesters, we can give the second generation antihistamines like levocetirizine, desloratadine. Second and third generation we can start with, but usually in first trimester we don't give these second generation antihistamines, and and additionally we can give the topical ones, the as I told you, the calamine and pramoxine, the preparations, they give immediate soothing and calming effect. So these things can be added during pregnancy in first trimester. Otherwise, after in second and third trimester, we can start with the usual doses of antihistamines.
Okay, I hope got your answer, Sanjay Meena. Ma'am, there is Harsh Singh asking for chronic urticaria. Is there any cure and what food medications should be taken?
For chronic urticaria there is a long course of chronic urticaria. Sometimes you have to take the medications for the longer duration. Like if it is present for 3 years, if it is present for 3 to 5 years, you have to take the medications. Sometimes there is a period of remission. there are no flares and there are no rashes of urticaria. So for that duration, you can skip the oral medications, but topical you can keep on applying for that duration also, that period also. But if there are flares of urticaria, you have to take the medication. It's not like कि हमने 1 year ले ली, हमने 2 year ले ली, तो अब हमें नहीं लेना होगा आगे मेडिसिन. आपने 1 year ले ली, 2 years भी ले ली, लेकिन अगर प्रॉब्लम आपको 3 years तक है तो आपको 3 to 4 years आपको लेना होगा मेडिसिन. उसमें दैट इज वेरी इंपॉर्टेंट, बिकॉज इन अर्टिकेरिया यू हैव टू टेक द मेडिकेशंस, अदरवाइज there is no permanent cure of urticaria, and sometimes the people after complete cure in after 3 to 5 years, or in chronic urticaria also after complete cure of 5 years, there is uh, relapse also sometimes. There is relapse of urticaria, any stress, any aggravating factor, any autoimmune condition, anything can precipitate in the urticaria in future. So you have to be precautious for that. If there is any to be in touch with your consultant or with your dermatologist to take the medications in between the relapses during the remission period.
Right. So, ma'am, Tanmay is here and he is asking, ma'am, क्या articaria जानलेवा है और organ को ज़्यादा affect कर सकता है?
नहीं, अर्टिकेरिया ऐसा कुछ भी उसमें मैंने जैसे बताया था, अर्टिकेरिया इज नॉट लाइक देयर इज नो सच कॉम्प्लिकेशन इन अर्टिकेरिया. बट इफ देयर इज एसोसिएटेड एंजियोएडेमा, जब स्वेलिंग हो रही होती है लिप्स के अराउंड, आईज के अराउंड, साथ में लेरेंजियल एडेमा जो होता है वो एक डेथ का कॉज होता है. जिन लोगों को रिपीटेड अटैक्स होते हैं एंजियोएडेमा के, उन लोगों को थोड़ा सा प्रिकॉशियस होना चाहिए, बिकॉज इफ देयर इज लेरेंजियल एडेमा दैट कैन लीड टू कॉम्प्लिकेशंस, लेरेंजियल एडेमा. Otherwise, urticaria can never be the cause of.
मतलब urticaria is, जैसा तन्मय ने कहा कि it's not जानलेवा, मतलब इसका proper symptom and proper.
It's just a condition. It is just a condition. It is not a disease. Urticaria is not a disease.
Right, ma'am. Ma'am, Varsha Narayan is here asking, what should be the focus of the physical exam for urticaria?
Physical exam. Can you ask the question again?
Yeah, so asking what should be the focus of the physical exam for urticaria?
Okay, physical exam. It is important to examine the patient in physical urticaria also. Sometimes the rashes, some rashes are present for longer than 24 hours, and the patient thinks that we have urticaria, and we are also thinking that it is urticaria, but the rashes are present for more than 24 hours. So in that case, urticarial vasculitis should be ruled out, because if there are any associated fever, myalgia, arthralgias, then urticarial vasculitis should also be ruled out. And in physical examination, the type of urticaria is, we can determine because of physical examination. Like if there is cold urticaria, we can do a cold precipitation test by using ice packs for over the skin for 20 to 30 seconds. It can precipitate urticaria. We can also do heat precipitation test if we think that there is heat urticaria. And so sometimes patient also complains of urticaria after they come up, when they come from sun. Because of sun exposure also people develop urticaria. So if there is exposure to solar and sun for some duration, then there is solar urticaria. Then aquagenic urticaria, if we wet the towel and we wrap around your skin for 20-30 seconds, you'll develop urticaria if there is aquagenic urticaria. So all these things are important to determine the exact cause which is precipitating your problem. And like there is cholinergic urticaria. Sometimes there in cholinergic urticaria, the rashes of urticaria are usually smaller than the normal rashes, and they're multiple. Like the usual urticarial rashes are few in number and they're scattered. And in the cholinergic urticaria, the rashes are very small. They're not the usual pale colored rashes. They're the small rashes, erythematous rashes. And it is cholinergic urticaria is mainly induced by can be induced by the exercises, hot foods, and all these things can precipitate cholinergic urticaria. So physical examination is very important in cases of urticaria.
Right. Doctor, there is one more question from viewer Rohit Verma. He's asking, hello doctor. I had a case of urticaria causing hives from a very small age. I still have some minor symptoms. The issue here is that can I take my COVID-19 dose with this medical condition? Since this disease is related to immune systems, do they really take screening tests before administering vaccines?
Okay, but there are no screening, although there is no screening test before giving the vaccines, but you can surely consult your doctor for to whom you are showing your the urticarial problems. You can consult them before taking the vaccine shot, and so that they can advise you any additional antihistamines if they want to prescribe before you take the shot, so that it doesn't precipitate problem if after taking the COVID-19 vaccination. So consult your dermatologist. He'll advise accordingly the medications, and then you can take the vaccine shot.
Right. So you should consult your dermatologist. That is the important thing here, ma'am, right?
Yes.
So, ma'am, there's a question from Nirmal Singh asking, ma'am, क्या allergies से blood pressure और mentally issues बढ़ जाते हैं?
Okay, no, it's not like कि allergy से mental issue, बस जो हमने जैसे discuss किया कि थोड़ा सा all the time you are itching and scratching over your body, and you are unable to focus on your work, you are on your daily routine activities. So this can lead to precipitation of mental issues. Sometimes if the problem is very chronic, you have it for more than 5 to 7 years, though. So if the duration is very is more, it can lead to some mental issues also. But blood pressure, there is no increase in blood pressure issues because of urticaria.
Urticaria, say blood pressure issues are not there, right?
Not.
Okay. Ma'am, Namita Singh is here and asking, can I use over-the-counter medications or do I need prescription drugs?
You have to go for prescription drugs, because over-the-counter drugs will give relief to you for 2 days, 3 days. But it is important to take the drug, even if you know the molecule. Then it is important to take the drug in proper dose, proper duration, and that the doctor only can advise you the proper drug, proper molecule, dosage, duration, and when to increase the dose, when to decrease the dose, and to add any molecule. That the only your dermatologist can advise you.
Right. So only you have to visit a dermatologist before taking any kind of drugs and any kind of medicines. It's required that you visit your nearby dermatologist. Ma'am, there is a question from Vishal. He's asking, can hives affect our eyes?
Yes, it can. If there's angioedema, if there's swelling around the eyes, that can affect the eyes also. So you have sometimes, if there is a repeated attacks of angioedema and there is persistent swelling around the eyes, so you need to consult a ophthalmologist also if you have repeated attacks of angioedema around the eyelids. So you need to consult your doctor for that also.
Okay. And ma'am, can COVID cause hives on face?
COVID sometimes. There are some few cases.
Right, right. So ma'am, there's a question from Aradhana. She's asking, ma'am, क्या ये genetic है?
Sometimes it is genetic also. You have family history in cases, in some autoimmune diseases cases also, you have family history of, not in every case, but there are some genetic genetic association also in cases of autoimmune conditions that are associated with chronic urticaria especially.
Okay, okay, ma'am. So there's more questions coming up. Naman Singh is here asking, ma'am, I have a red spot on my hand. How can I reduce it naturally?
Okay, red spot, that you have to, if there is any associated itching, and you have to rule out the proper cause of that red rash. Otherwise, you can use a moisturizer or something for on regular basis. Maybe it can reduce your problem. Otherwise, after 1 or 2 weeks, you can consult your doctor for the same.
Right. So, ma'am, when we talk about treatment, so what are the treatment options which are available for urticaria or hives?
For urticaria, we usually start with the antihistamines, the in usual doses. Then we updose them after 2 weeks, 4 weeks, 6 weeks, or 8 weeks, according to the response. And in if there are repeated attacks of angioedema, there is angioedema of the eyelids or nose area. To prevent any complications, we have to start with the steroids in the doses, in the higher doses. Then we can taper them off in the gradually, the steroids and other immunomodulatory drugs that can be prescribed in this urticaria are can be methotrexate, cyclosporin, and some biologicals like omalizumab can also be given. The injection, subcutaneous injections of omalizumab are given. That can also prevent urticaria can maintain remissions in urticarial conditions. And there is allergen test also. Sometimes we do allergen test, this skin prick test to rule out, to determine the cause of urticaria.
Right. So, ma'am, there is Tanya asking, I have been diagnosed for chronic urticaria in a treatment, taking medicines for more than 1 year. Itching became a big problem for me. Is there any permanent cure for this?
No, there is no permanent cure for urticaria. You have to take the medications, whether it be oral and or topical. And if your problem is very chronic and it is disturbing you in your daily routine activities, so you can go to biologicals. You can start with the biologicals according to your doctor's advice. Start with the biologicals like the omalizumab. They give the period of remission is more for if you're taking biologicals, and it will provide relief for a longer duration.
Right, ma'am. And what lab tests are needed and why?
Okay. The lab tests like complete blood count, the ESR, serum IgE levels, thyroid antibodies, and TSH, thyroid stimulating hormone levels, and connect to rule out any. Sometimes there are connective tissue diseases also that are associated with the urticaria. For that, the investigations related to connective tissue diseases is also important, and like CRP is also that, C-reactive.
Okay, so I hope, Tanya, you got your answer. Ma'am, is there, urticaria is contagious?
No, it is not contagious. Not at
Okay, okay. So we are getting more questions from live viewers, or they're asking a question. Shalini is asking, I get urticaria rash every alternate day. The rash starts slowly and spread all over my body, including my head. It is really itchy, big round bumps from. I have to take steroid injections to get rid of this. It's been there since more than 2 years. I tried all medicine. Is there any permanent treatment for this?
No, there is no permanent treatment for this. You have to take the injections, the steroid shots you are taking, and you otherwise you can ask your doctor to put you on the biologicals, the omalizumab drug, and accordingly you can take the injections of omalizumab that will give him remission for a longer duration. Otherwise, there is no permanent cure. You have to take the medications or the injections you.
Okay. So that's the only option, Shalini, that you have to take the steroid as told us by ma'am. So ma'am, Yash is asking, what tips do you have for hives or any other allergies?
Tips like there are no, but it is always related to the cause of the problem. The underlying cause, the triggering factor should, if it is avoided, then your problem is also avoided. Sometimes the people they use band, as I've told you, they're using bands on the hand, and there's continuous itching and urticaria. Until and unless you remove that band, the problem won't resolve. So the triggering factor should be avoided. Uh, If the triggering factor is avoided, the problem will also resolve. And otherwise, you can the medications are always.
Right. So, ma'am, Shalu is here asking, is a new skincare routine necessary when working from home?
New skincare routine. Okay, you can then skincare routine like the face washing, washing your face, toning, and moisturizing. It is important if you're working from home also, because your skin always needs hydration. And even if you are indoors, the blue light, the lights of the laptops, and the lights of the mobile phones, all these things affect your skin, and and the harmful rays, they affect your skin. So the cleansing, toning, moisturizing, and using a sunscreen, these are important also. These are important if you're working from home also.
Rightly said, ma'am. And our viewers, I hope you had all the answers of your questions, ma'am. It's been quite an interactive session. So, any takeaway message for all our viewers?
Okay, so related to urticaria, it is important if you have a problem like hives or पित्ती की कोई परेशानी या इस तरह का कोई रैश डेवलप हो रहा है, so it is important if you take a note of all the things that are precipitating your problem. Keep a note of all the things that are precipitating your problem. Go and consult your dermatologist. Take a proper medication and follow all those medications that he or she is advising you. And try to avoid that triggering factor, like if it is heat, cold, exercise, or anything that is precipitating a problem. I would try to avoid that problem and take proper medications.
Yes. So, do visit your nearby dermatologist if you have any kind of such problem. Right, ma'am?
Yeah, right.
Thank you. Thank you so much, Dr. Meenal Mittal, for your valuable time. It has been very informative session for our viewers, and I am sure they will use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, they know now they know that instead of self-medication, it's better to approach a nearby dermatologist. It's great to hear you, and we really look forward for many more such sessions in coming time with you for our viewers. Thank you, viewers, for your participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our Facebook page, all about skin allergy. We are also available on YouTube, Twitter, and Instagram. Thank you and good day. Thank you so much, ma'am.
Okay, thank you everyone. Thank you.